Hey guys, welcome to Nursing Career Advice, where today we're going to be talking about the top 5 things that I wish I knew as a nursing student to help me get through nursing clinicals. Nursing clinicals can be a long day, so any tips are appreciated. If there's anything that I don't cover today that you think is important, please feel free to leave a comment. I'd love to hear what you guys have to say. And as always, if you like the content and would like to support the channel, please like and subscribe. And anyway, we'll jump right into the top 5 things that I wish I knew as a nursing student to get me through nursing clinicals. Tip number 1 would have to be to have all of your necessary equipment ready to go. Now, necessary equipment, might be debatable for some people, but I'm going to say that as a nursing student, at a bare minimum, you're going to want to have a pen, a stethoscope, a water bottle, and potentially a lunch, and possibly, if you take medications, have those things ready to go. And by ready to go, I don't mean trying to gather them all together 5 minutes before you run out the door in the morning. I'm talking about the night before, either having them gathered and put right next to the door so you can just grab them on your way out, or already having them put in your car the night before. Not having those things can make a long day even longer, and having them can really make your day run a lot smoother. Tip number 2 is to have your cell phone on you and to have your instructor's contact information and make sure he or she has your information as well. Now, that might seem like a strange recommendation to have, but being able to contact your instructor in case of an emergency, or them having the ability to contact you in case of an emergency, can be a very important thing, just in case something does happen during clinical rotations. You would think, well, why can't they just come find me? Well, they have, around 10 other students that they're responsible for, and they have to wander around a whole hospital or whole facility in order to find you guys. So sometimes it's more feasible, if there's some type of emergency, to just call everyone up or send somebody a text in order to relay information. That can be a really huge tip. Tip number 3 is to eat something for breakfast. Now, personally, I'm not a huge breakfast person, and I'm not telling you to, stop by Denny's for a grand slam on your way to your nursing clinical rotation. But you do need to eat something, anything that you can stomach, even if it's just some fruit, some yogurt, a little bit of cereal, whatever. Being a nursing student, you're going to see some things that are kind of gross. And as a nursing student, you may or may not be accustomed to those things. And so having an empty stomach can make you prone to nausea and even passing out. So it can be really important to have just something on your stomach to raise your blood sugar and keep your energy levels up throughout the day, at least until lunch. And this tip is especially for those going into the the OR. The OR is the place where I would say people pass out the most in clinical rotations, and so it can be really important there. My 4th tip is to be respectful and remember that your patients are patients. They're real people. They're not mannequins like in your simulations that you've done. In order to highlight this point, I think it would be appropriate to share a story. While going through my clinical rotations, a student was in the ICU and was able to participate pretty extensively in the coding of a patient. Now, the nursing student was allowed to help with intubation, doing chest compressions, and a plethora of other things that students sometimes may or may not be allowed to participate in, but fortunately they were allowed to participate in this. The nursing instructor did show up for the code as well. And toward the end of the code, the family was allowed back in the room, the patient was stabilized, and the nursing student leaned over to the nursing professor and said rather loudly, "That was awesome," right in front of the patient and the family. Totally inappropriate. Now, it's okay to be excited about seeing and participating in something new, like a code. It's not okay to talk about it and express those feelings in front of patients. It's better to talk about things like that in the post-conference or in the break room or somewhere where patients and their family don't hear that. We have to remember that patients are going through something that's probably life-changing if they're in the hospital, and the things that they're going through are a big deal for them. So it's important to be respectful of boundaries and to talk about things in the appropriate setting. And that brings me to my final tip, tip number 5, which is to jump right in. Try everything. Do anything that your preceptor allows you to do. You're there to learn, and really you get as much out of the experience as you want to get. Generally, most preceptors will let you do anything, and I would just recommend really jumping in, even if it's something out of your comfort zone or something kind of gross like a rectal tube or a catheter or something like that. Really just jump right in there, get as much hands-on experience as you can. It's the one time in your life where you'll, really just have the opportunity to jump in and do things with little to no consequence. I mean, obviously you don't want to intentionally hurt a patient, but you have the opportunity to have somebody watch you and guide you do things. So anyway, guys, yeah, those are my top 5 tips to improve your clinical experience. Like I said, if you have any others, feel free to leave them in the comments, and we'll catch you on the next one. Thanks, guys.